Don here, Women's Ministry. Today's topic is women and depression. And some of the things what we're going to learn in this area is we'll talk about and learn the symptoms and causes of depression. What is depression and what does the Bible say about it? We'll be able to learn the treatments that are available for depression. And we'll be able to learn how depression affects women during pregnancy and menopause. Now, I'm not a psychiatrist. I don't have a PhD. I did learn through my bachelor's degree in human service and through part of my social work degree as well. We learned about different mental health, but I'm not here to diagnose you. The best bet is to see your own doctor when you're having problems, because your doctor knows you more than anybody else. And then if the doctor feels that you need to have more help along the way, he'll help you and he'll recommend people to you. But I'm just here to give you the information, okay? So I'm not gonna diagnose you, and I'm not gonna send you off to someone I don't even know. So we're just gonna learn about it today. And if you find out that maybe you have symptoms of depression, or maybe you're suffering from it, please see your doctor, okay? Get a physical, make sure everything is okay, okay? So that's what we're going to do today. So let's first look at, I don't want that one. The meaning of depression from the Bible and what it says. We'll start out with that. And it says the meaning of depression in the Bible is often intertwined with profound emotions and struggles faced by faithful individuals. Scriptural figures like David, who lamented in the Psalms, reveals that feelings of despair are not only of weakness, but rather an integral part of the human experience. So it's our emotions. In Psalms 42, David's soul has a downcast, echoing the sentiment that even those closest to God can grapple with deep sadness. And they do. They experience the same emotion back then as what we do today. So they've lived with sadness and different emotions, anger. Even Jesus did. But this is an acknowledgement and encouraging believers to confront their feelings rather than suppress them. So instead of suppressing, saying, I don't have any problem. If you are experiencing them, express them and get the help that you need. Sometimes depression can be very little, or depression can be enormous. So if you experience either one of them, face them and know that they are true. So confront these feelings rather than suppress them, fostering an environment where vulnerability can lead to healing. So we can heal the depression. It doesn't have to go unnoticed. Moreover, the Bible offers a framework for understanding depression through the lens of hope and restoration. And Jesus can help you with that. In Matthew 11:28 through 30, Jesus invites those burdened by their struggles to find solace in Him, suggesting that seeking support from a higher power can be transformative. Jesus was higher power. He did a lot of healing, not just depression, but look at Lazarus. He brought Lazarus up from the dead. He's the great healer, isn't he? So this call to rest implies that relief from emotional turmoil is attained through faith and community, encouraging individuals to share their burdens with others. And if need be, we can share them with a counselor if need be. Ultimately, the Bible's narrative provides not just validation of feelings of depression, but also a pathway towards renewal, reminding readers that are never alone in their darkest moments. We all have depression, one way or another, and it's how we deal with them to make them better. We all have darkest moments, no matter what. So it's not something that's an embarrassment. It's something that we can overcome. So here's some questions that you may have, like, who in the Bible struggled with depression? Do you know? Yeah. David, Elijah, Job, Jeremiah, Jonah, and even Jesus showed signs of emotional anguish and deep sorrow, offering reliable examples of depression. Everybody goes through depression, one way or another. Maybe it's really short, maybe it's a long time. But is being in a depression a sin? No. According to the Bible never defines depression as a sin. Many faithful believers experience it, and God responded with compassion, not condemnation. He has compassion for those who are feeling down and depressed. How did God help people with depression? Well, God offered rest, encouragement, presence, and purpose, meeting each person with a grace during their emotional struggles. So He had compassion with us. He was always there with us, even in our darkest moments. What does Jesus teach us about emotional suffering? Jesus showed that even the Son of God experienced emotional pain. He prayed honestly. He leaned on God and trusted His Father's will. Can Christians seek help for depression? Yes. Seeking help through prayer, scripture, counseling, community help, they're all biblical and healthy responses to emotional distress. I remember losing my dog, and I was very upset. I was depressed for a very long time. I lost my home to a fire. And not only was I scared what I was going to do next, but I was depressed. But I always went to God in prayer, and I waited on Him and trusted Him. Nehemiah, he had depression. but his depression wasn't related to the church parish or the church council in vision or concern. He had a wide horizon, and that concern drove him not to be too depression or a fatalistic attitude, but to God, went to God in prayer. So those are some of the things. But let's learn a little bit more about depression before we move on. Women and depression, they're twice as likely more to have depression than men. Depression affects 17% of Americans, and treatments are 75 to 80% effective. Sometimes they may only have, like if they have to have medicines, it's only a little dose, and that's all they need to have. Everyone gets depressed at one time or another in their life. Maybe something's not going right in your life that you want. Maybe you wanted this job, but you only got this job. I'm depressed. So what else can you say about depression? Because we're all going to go through it. Signals of change in women need to make, like maybe their moods change. God could use depression to motivate women. That could be. Maybe he wants us to do a change. Make a change in our life. So he may use a depression to change our area that we need to go down to. So you can use that to change us, to build on us, to push us in a better area. So what are the more symptoms of change or symptoms of major depression? Depressed moods or less interest or pleasure. That'd be a way God could motivate us to change. We're not interested in what we're doing anymore. Maybe he wants you to stop knitting and start cooking for people. I'm sick of knitting. I'll try something different. Start cooking. So he can make a loss of interest. Now, feeling of worthlessness. That's another symptom. Excessive or inappropriate guilt. Inability to concentrate. Fatigue or loss of energy, where you just want to stay in bed all day. That's not a good thing. Insomnia or increased need for sleep. Now, I get those sometimes where I just can't sleep at night. I don't know if that's from depression, but I know I have a lack of sleep habits. I have a hard time to getting to sleep. Maybe it's because of my old age. Psychomotor agitation or retardation, like psychobabble. Psychomotor maybe affects the brain, depression, where you kind of just babble and not really words are coming out. Significant weight gain or loss. Are you eating because of depression? Or did you stop eating because you lost interest in food? It could go both ways. reoccurring of thoughts of death or suicide. If you have those thoughts, I need you to go get help. You can go to the hospital. You can go see your doctor. You can call 911. Go down to the fire department. Wherever you can get to. But if you're having thoughts of death and suicide, I want you to get help immediately. I don't want you to hurt yourself. So make sure you do that. Your family doesn't want you to hurt yourself either. Okay? So I need you to make sure you do that. Feeling of hopelessness or helplessness. Two different things. Hope is having a hope for the future, or helplessness like you just can't do anything right. That's another symptom of depression. Depression's real, and it can hurt. So I need you to get help, to seek your doctor or somebody, help you get on the right track. But depression is over-presented in women by a 2-to-1 ratio. Absence of a confident, someone to talk about. So if you're not confident in yourself, you may be struggling with depression. You've got to be confident about something in your life. Like, I'm the best cook. I am the best person at work. I'm the best writer. I'm the best driver of school buses. You got to be confident about something. You're confident you're good at something. Less than high school education. Maybe you don't have the energy to move on in your life for what your purpose is. Maybe you say, well, I'm just going to do high school. I don't want to do I don't want to go on to college to get my degree in let's say, engineering or whatever. Is it because you don't want to? Or maybe you're not confident enough to get into a job like that. There's two different ways. If you really don't want to go to college, you don't have to. There's all kinds of things you can do. Teach school online. Maybe presence of young children at home. Maybe they're adding stress to you. Maybe you're with them 24/7 and you just need a break. Maybe a friend or a neighbor or someone you trust can watch them for a couple of hours while you go do the grocery shopping, or just go down to the park and just relax and see what's going down there. Just even take a walk. Find something interesting. Go to a movie. Take yourself out for dinner. Or even just soak in a bubble bath. All things help. Maybe you have lack of work outside the home. Some people rather be at home instead of being outside the home. Maybe the marriage is unstable. Might be unstable. That could put a damper on your mood. Feeling of helplessness, that you can't do anything right, or things are not going right in your life. Anxiety, anxiousness could be overcoming you. History of abuse. Um, Maybe you've got abuse in your life or had abuse in your life. Domestic violence, child abuse, child neglect. Maybe that's something that's going on in your life that's causing all this depression. I know that children who have experienced abuse can also have a big depression or anger problems. They strike out, and that's true for abused people. Estrogen and serotonin. They're kind of like a brain model. It affects the lymphatic system of feeling and mood. So here, with serotonin, what does it do? It's in your brain, but also in your stomach. Serotonin plays a role in many of your body's functions. That's a big thing. Maybe you don't have enough serotonin in your system. Serotonin in your brain regulates your mood. It's often called your brain or your body's natural feel-good chemical. So when serotonin is at normal levels, you feel more focused, emotionally stable, happier, and calmer. But if you have low levels of serotonin, those are associated with depression. So if you have a low level of serotonin, you could suffer depression. Many medications are used to treat anxiety, depression, and other mood disorders, often target ways to increase the level of serotonin in your body. So your brain could have lower levels or higher differences in levels. What is serotonin? Serotonin is a chemical that carries messages between the nerve cells in the brain and throughout the body. Serotonin plays a key role in such body functions as mood, sleep, digestion, nausea, wound healing, bone health, blood clotting, and yes, even sexual desires. Serotonin levels that are too low or too high can cause physical and psychological health problems. But that's even with estrogen. Estrogen is a crucial sex hormone that plays a significant role in maintaining sexual and reproductive health in both males and females. It's produced primarily in the ovaries in females and the smaller amounts in the testes in males. The functions: estrogen regulates the menstrual cycle and supports pregnancy and influences secondary sexual characteristics. Couldn't get that one out. It also impacts mood, sleep, bone health, heart health, and metabolism. So, estrogen levels drop before the beginning onset of a menses period. It also, estrogen levels are high dosage in pregnant women. Estrogen levels drop after the mom has the baby, or slowly drops while breastfeeding. In perimenopause, the estrogen drops. So genetic coding sets a limit on how fast serotonin is produced. Serotonin deficiency rate, which could lead to PMDD, which is premenstrual dysphoric disorder, which is your major depressive disorder. So that's regular depression is different from major depression. When you have regular depression, you can actually function. But with PMDD, premenstrual dysphoric disorder, is much more severe form of premenstrual syndrome than PMS. It may affect people of childbearing age. It's a severe and chronic health condition that needs attention and treatment immediately. Life changes, and sometimes medicines can help manage the symptoms. So how do you know if you have PMDD? The exact cause is really not known. It may be abnormal reaction to normal hormones, changes that happen with each menstrual cycle. The hormone changes can cause serotonin deficiency, which is found natural in your brain and intestines and blood vessels. So what else can we say about PMDD? I'll give you a few examples here. They're depressed moods, sadness, feeling of hopelessness, feeling of worthlessness, mood swings, anxiety, increased anxiety tension, feeling on the edge all the time, self-critical thoughts, increased sensitivity to rejection, frequent and sudden tearfulness, increased irritability, anger, or both, conflict with people that you know, with family, coworkers, and anger. But sometimes it could lead to not just maybe a few days of the month. It actually, sometimes they're onset for several months. And there have been known people that they just stay in bed. They just can't work. They can't go to school. They can't do anything in life. They're just stuck. And that's why it's important to get help right away. If you're in a mode where you can't do anything in your life, you can't make dinner, you can't wash dishes, you can't take care of your kids, that's when you need to really make sure you go get help or call somebody to get help for you. But that's a serious disease. And have a doctor look at you and try to figure out if you have PMDD or if it's just a regular depression. What do they need to do for you next? Some of the things that can help with PMDD is reduce salt or caffeine. That'll start the process. Avoid any nicotine or alcohol. Don't take that. Avoid junk food like carbs. Take vitamins like B6 and vitamin E. Try to exercise. Try to get enough sleep. Your doctor may recommend medication like Prozac, Paxil, Zoloft. Sometimes you won't need to take them all the time though. It's been proven that some patients, they only need to take it during depression or PMDD, and don't need to take it any other time, only just for maybe for a few days during that time. Your doctor will need to discuss that with you though. Depression can continue during pregnancy. Untreated depression during pregnancy can cause premature labor and underweight newborns. So we have to talk to our doctor. If we become pregnant and you're on medication, you need to discuss the alternatives. Okay? Conception. Birth defects can happen if you're taking the meds, but it is rare. It's rare, and it's only a small, and that's during the first trimester. It's rare. Birth defects carrying to term premature delivery. You should be able to have no problem with that. Again, make sure you make all your appointments, attend all your appointments, and keep a checkup on your pregnancy with your doctor. Can exposure to medication cause problems to the baby after delivery? Again, that's rare. It's a low chance, especially if you're breastfeeding and you're taking the medications. Yes, can that happen? Yes, the baby can be input into taking some of your medication as well. Can it cause child development? Very rare, they say. But like I said, with breastfeeding, if you're breastfeeding, talk to your doctor about it, because the baby usually gets the milk from the mother, and the mother is medications that can affect the baby. So talk to your doctor about that. Postpartum depression. Oh, I had it bad with my first one. 85% of women will have the baby blues. I cried. I tried to my old pants, thinking I could get out of the maternity pants and into my new ones, and the material ripped, and I just sat down and I cried. And of course, guys in my home, my brothers and the guys that were there, they said, "What the heck is wrong with you?" Of course, my mom knew. You know, she helped me through it. So I had the baby blues. I had postpartum depression. Didn't last very long, but it was there. Some people have severe symptoms, and 8% to 15% of people do, where they just feel like they can't take care of the kids after they've had them, and they have to have help. Maybe grandma has to come over and help with the baby. They too can be treated. Women who are perimenopause, they end up with hot flashes, cold sweats, sleep disturbance. They can also get therapy replacement. Can help. Serotonin therapy can help. But general principles of treatment are through evaluation of your doctor, education, and reassurance. So, if you suffer depression, some other things can help you, like dieting, exercising, support. Maybe join a support group, counseling can help. Your doctor, sleep, medication, like I told you before, but there are alternatives as well that you'll have to discuss with your doctor. In conclusion, if that's how God clothes the grasses of the field, which is here today and tomorrow is thrown into the fire, how much more will he clothe you, you of little faith? So, God knows what you're going through. He will never leave you or forsake you, and he understands what you're going through. So he's going to be there to comfort you. So I want you to pray, not to forget that always go to God and ask for help too. It's not always, start with God, pray to him. He's the great healer. He's always going to be through all your dark times. So, but I also, if things start getting really bad, I want you to see your doctor, because depression is not fun to go through. It's like going through a dark tunnel, and it's no fun. So, I hope this helps you to understand a little bit about depression and some things that you can do to help. But in worst case scenario, pray and seek help, especially if you're experiencing suicide or death. I don't want you going down that road at all. I want you to seek help or get someone to help you. Call your neighbor, call a friend, call your work, call somebody, reach out. But always pray too, okay? Because God is a great healer too. Or even a prayer warrior. There's lots of churches out there that will pray for you as well. That's a good one. Half of the people from the church help you. Your pastor's a good one. Yeah. So until next time, stay in the bright of the light where the Lord can lead you, and stay out of the darkness or get help. God bless you and be with you. Amen.